All right, Muscle Love 101. So there's a lot of different conceptions or misconceptions out there about, do you stretch a muscle? Do you not stretch a muscle? Do you use a foam roller? Do you use a stick, vibration? There's a lot of stuff out there. So I'm going to try to make some examples, kind of a case example, and of course some analogies to try to simplify it. And that way you know, when do you need to do it? When do you need to give the muscle some love? And how do you do it? And what's the right time and way? So first thing first, let's go over some of the basics to make sure we're all on the same page. Every muscle has a starting point or an origin and an ending point or an insertion. When the muscle contracts, that muscle shortens. The insertion draws near the origin. Whatever joint it crosses, whatever axis, it moves in that plane. So you can imagine that if I'm activating my calf, let's say that I'm running 1 mile. And let's say that mile we take around 1,600 steps. That's around 800 times your calf muscle is activating. Although if you've been following along, you should be pushing with the tush and not using your calf to propel up and down as much, but that's another topic. So imagine what we need to do to prep up before a run, and how do we treat it afterwards, and do we need to do things outside of running? Okay, so I want to use this ACE bandage as a model. It's sexy, isn't it? So imagine when it comes to stretching, you're familiar with what we call static stretching, where we're taking that muscle, we're going opposite. When a muscle activates, it shortens. When it's passive and off, we're going now in the opposite direction. To stretch it, you have to go in opposite of the direction. Example, the calf, it points the toe or the ankle down, which is plantar flexion. To stretch it, we need to go the opposite direction into dorsiflexion. So imagine now we're going into dorsiflexion. You're used to this static where we go to the end and we just hold it there for about 30 seconds. We're going to talk about when that's appropriate, if it's appropriate. And then also dynamic, we're kind of going through the range of motion, but we're not actually going past that point of that end range where we're getting that stretch. So we'll talk about when and where and why and how you should do it. Okay, so here it is. This is going to be new to some of you guys, and it's going to be old hat to some of you. This model's changed over the years. Back in the day, it was let's hold a static stretch before exercise. They found out that actually increases your likelihood of injury. They show that stretching your hamstrings before a soccer game can actually increase your likelihood of tearing or injuring your hamstring. So it's all about this dynamic movement before, or increasing the blood flow. So before a run versus after a run. Let's go back to this beautiful model, this calf example of the muscle. Before I exercise, before I run, I want to just take that muscle through its entirety of its range of motion. I don't want to go past and hold to that end range. I want to just work within that range, increase the blood flow, get the muscle moving. That's where we have this dynamic warm-up. Here I'm dropping my heels down, back and forth. I can be driving my knees past my toe, anything that gets my muscles and calf moving, but I'm not holding and trying to stretch it and lengthen it. We'll talk about when and if there's a time for that. Then we have after. So now, this is when it's appropriate. After running, after you use that calf muscle, thousands of times, it's constantly lengthening and shortening. It's a good idea to statically stretch afterwards, to hold. This we do for reps, about 30 reps or so. Here, as we are, now we're taking that muscle that just lengthened and shortened a lot, and we're taking it to its end, which is a little tighter than it was before, and we're trying to go past that point just slightly. Not to the point of pain, but the point I feel that stretch. I hold that. 30 seconds. It's boring, I know. After that 30 seconds, it is good to come out of it. About 10 seconds, let the blood do its thing, let the muscle, the tissue kind of relax, and then go back into it again. 30-second hold. So typically after exercise, that's when we do that 3 times for a 30-second hold of the main muscles that we used. So with runners versus hockey players, they're gonna have different muscles that they're gonna wanna stretch afterwards. So before, dynamic. After, static. All right, Matt, but what about after? What about when, is there other times that I can stretch? Do I need to stretch? Great question, I'm glad you asked. Do we need to stretch? Does everybody need to stretch? The answer is no. Some people stretching is either just ineffective, some people can actually be provocative and agitate something, and there are some people that it can be helpful. Let's talk about an example where it can be helpful. Let's go back to our example of our calf. Our calf muscle, a great test for that, I use this test all the time. It's an easy test you can do on your own. I do with patients, pre-test, post-test. We're looking for differences in effectiveness of treatment. Are we getting better? Is there difference side to side? This is a good test to be able to know how to do. So hear me out. What you're going to do, and you're going to do this on both sides, this is going to tell you if you're tight or not only comparing side to side, but to norms or normative values. You can go up to that wall, start about 3 inches away, be barefoot, keeping your foot straight and your heel down. Can you tap your knee to the wall? If you go and you're just about knee to the wall and the heel's coming up, it doesn't count. We're going to try to find that sweet spot where I can, as far away as I can, keeping my heel down, tap. Once we do that, we record this distance here, the distance from my toe to the wall. Normal, believe it or not, is around 4 to 5 inches. I found that less than 2 inches, most of the time it's going to affect your running. And then you're going to compare to the other side. So we're seeing, is there a difference? Is it close? If this is restricted, this is when we would want to stretch. You don't want to do it right before exercise, maybe on your off days, maybe in the evening, but then this is where we're trying to take that tissue, that muscle, and it's become adaptively shortened. We're trying to take it past that range. We're going opposite of the muscle does. We're not shortening it. We're not activating it. The muscle is relaxed and we're going past, and we're holding that. We're trying to create a new normal, a new length to this tissue to try to get it within that normal range. So hopefully that made sense. The next post is going to be about tools. When do we need to use them? Do we need to use them? Foam roller, the stick, massage gun. So hopefully this answers some questions for you guys of when and how to stretch and when it's indicated, both before and after exercise and outside of it. Muscle Love 101, part 2. You like that? I felt like I had to do that with my hands again. Welcome. Last post was all about stretching, how to do it, when to do it. This is all about tools or toys, foam roller, massage ball, when to use these and how do you use these. Okay, let's separate this out into 2 separate components. We're going to have the symptoms up at the top, and we're going to match it with the treatment, being the modality. Modality means foam roller or stick or whatever. So it's either range of motion or recovery. What's another way to say that? Is it tight or sore? So going back to that example about the calf, is it that your calf is truly limited in range of motion? It's been adaptively shortened over time? Or is it just sore? We know that exercise creates soreness. We break down the muscle tissue. That next day, sometimes 2 days later, that DOMS, delayed onset muscle soreness, can sometimes cause that soreness. So what do you do? So let's go ahead and match these up. To make it as simple as possible, if we're talking about a range of motion issue, the muscle is tight, it's been adaptively shortened, we're going to push or compression to the muscle. I'll explain that more in a minute. Versus just normal recovery and soreness, we're going to do more gliding. And so the difference is push versus gliding. The force is more perpendicular with pushing, and when we're gliding, it's a little bit more obtuse. And then also we're going to see there's going to be some movement with it. No movement, movement. I like to think of that muscle fiber like a rope. If there's a knot in that rope, a trigger point, small little contraction in the muscle fiber that won't let go, then this is a way to first address the knot and then lengthen it out. When we push on a muscle, when we push on a trigger point, when we apply that deep sustained pressure for about 60 to 90 seconds, I know if you thought 30 seconds of stretching was boring, this is a long time, but you can release it. Tone, high tone is the muscles amped up, it's tight. Applying deep sustained pressure and holding it, not moving it around, holding it, can help to lower or reduce tone. So if you are tight or range of motion restriction, pushing can help with that. Now the world is yours. What do you push with? So hopefully this makes a little bit more sense now. We have so many different options to push, from my hand, from a muddler that I think you make drinks with, lacrosse balls, the peanut. All these things are just ways to create compression or push, sustain pressure to a muscle. The more dense it is, the firmer it is, the deeper it's going to go, the more aggressive. The surface area, the smaller the surface area, it's going to go deeper. It's going to be more aggressive versus wider versus softer. So you can see how we're just changing that push however you want, whatever tool is necessary. You might find that this ball is better for one spot because you can't fit anything else into there, and so on and so forth. So there is no right answer. It's whatever way that you can find, but the most important is for this is you're not moving it. You're just holding it. You're searching to find that spot, that tender knot, and then holding 60 to 90 seconds. Let's give an example of what that looks like. So here I'm using a ball, the peanut, on my calves. I'm moving only to find that tender spot. I don't keep moving. That's one of the biggest misconceptions is if you just keep moving around, that's gliding. That's good for recovery. But if we're trying to improve range of motion, we want to hold it. So find that tender spot, hold 60 to 90 seconds. And the other scenario was recovery or soreness. That's very different. So instead of pushing, we're going to do more gliding. And so we're changing the angle of that force and we're incorporating some movement with it. So in order to help facilitate some of the movement of those byproducts of exercise, this is a way to start to get some of that. It's not lactic acid. That's kind of an old school thought. It's all these other inflammatory enzymes like prostaglandins, cytokines, substance P, bradykinin. These are all in the muscle when we're sore and kind of hanging out. This gliding helps to get rid of it and your body can excrete it. So what are some examples of some tools that we can use for gliding or generalized soreness? But this is where we've got our foam roll. We've got the one with the little nodules on it, so it's a little more aggressive, the dense foam roller. And now back to that scenario with the calf, I can roll, if my calves are just sore, they're not adaptively shortened, I can roll that muscle along the length of that calf or roll that foam roller along the calf to try to facilitate movement and gliding. I can use a stick, another way to also get some movement onto the tissue. Instrument Assisted Soft Tissue Mobilization, IASTM. A lot of stuff out there. You don't need to get anything fancy. They make these anywhere from $500 to $4,000 for a set. You can use a spoon, you can use a wooden spoon. It's just using an instrument. Back in the day, they used to use like animal ribs, so they didn't have that stuff back then. But this is a way that you can apply a little bit more sustained gliding to the tissue, meaning muscle. These always come with different contours and different sharpness or dullness to also help facilitate that pressure. And same with this, the more vertical you are, the more aggressive it is. The more horizontal, the less aggressive. The massage gun. Great way. I'm going to save that because it's a whole hot topic. That's going to be the third post in the series. So Matt, can a tool be used as a hybrid as both? Yes. Great question. I love it. Or for two purposes. I can move it, search, find a tender spot, and then hold it. Or I can just move it, but know your intention. What are you trying to do? Are you trying to improve range of motion? Are you trying to increase or reduce muscle soreness and improve recovery? Think about this though. The surface area is so broad on a foam roller that when you're applying that force, it doesn't go as deep. Imagine like I have my hand and I'm pushing on somebody's back versus my finger. This is more aggressive. This goes deeper. It depends on the spot, how aggressive you want to be. And I'll talk about next post about how close to exercise that you want to do some of this stuff. Part 3, we got a hot topic. Massage guns and pain. What do? Do you go after the pain? Do you destroy it? Do you leave it alone? Massage guns. There is so much out there on the market. Just from watching this, from listening, the internet, you're going to get ads for it. I'm going to talk about what it is and when do we use it, and hopefully answer some questions that you may have. The key is movement. Even if you hold that massage gun over one spot, it's not staying static. It's not staying still. It's moving constantly. So what is that doing? Applying pressure to the tissues, on, off, on, off. We're creating pressure differentials. We're getting blood flow. We're getting the tissues moving. But when do you use this? Before running, after running, or at all? So before I try to simplify stretching as two things, are you trying to improve range of motion or is it just for recovery? Range of motion is that tissue has been adaptively shortened. You lost some of the length and the extensibility of that muscle. it's tight. That's where we apply that push, that deep, sustained static pressure, holding to try to release that muscle tone. Or is it for recovery? When we exercise, we break down muscle tissue. You get sore that next day, 2 days later. There's all these byproducts of exercise and muscle breakdown that cause that soreness. So if that's the case, we're trying to glide. We're trying to get that tissue moving. Hopefully you're already getting some ahas. We're trying to move things in and out. Let's simplify this even more. Hold or move. Those are our two situations. Are we taking the modality, the instrument, whatever it is, are we holding and not moving, or are we moving? Are we constantly moving and applying that dynamic, that force? We're going to separate these two out, and this is going to answer the question for you. As far as before running or after running, when you use a massage gun, remember before with stretching? Before, it was all about the dynamic movement. We were taking those tissues, moving them not through their full range of motion at the end range. We're just moving within that range of motion to get the blood flowing, to get those tissues warmed up. So, movement. After, that's where that muscle activated thousands of times, it wants to shorten up. We're trying to statically hold and loosen it up. What does the massage gun do? It moves. It doesn't apply that static pressure, even like we said, if it's in one spot. So if you're going to do it at all, do it before. Get those tissues moving. Okay, so we talked before about after, not immediately after exercise, but later that night, that next day, on your off days, gliding. These are the different instruments. If you're holding it, it's trying to push and increase range of motion. If you're moving it, you're trying to glide and get that soreness out or get the tissue moving. What do we do? What do we do if we have pain? Do we respect it? There's something we like to call in the business of silent culprit, noisy victim. Let's talk about an example. The IT band. You have pain on the outside of your knee. This is the noisy victim. It hurts. It's telling you. Is that where the main problem is? What caused that in the first place? Could it be a silent culprit, a dysfunction somewhere else in the chain, usually above and below the joint, that's causing that? Maybe you sit all day as your desk job. We have tight hip flexors. Your psoas becomes tight and adaptively shortened. So what does that mean? What that can cause when we run is a lack of hip extension and more wearing on the IT band. So we tend, my personal opinion, I don't go after the noisy victim. What's the point? It's just going to agitate it. It already hurts. It doesn't feel good. Versus the silent culprit. And then again, to further make sense of it, if we're trying to address that, are we going to glide or are we going to push? If that muscle is adaptively shortened, you hold and push. How do you know if it's shortened? Do a test. Compare both sides of each other. Do you pass the screen? So personally, I don't go after the pain. I don't use any of the modalities, the tools, the instruments directly on that spot. I let that baby heal. I'm trying to create an environment to foster healing, to let your body do its thing. Let your body heal. My boy Ryan says, I've been told that rolling the side of my legs could cause damage to your IT band. I love this question. It's not going to damage your IT band. But is it effective? I'm going to post to my story a long post I did on a hot topic as a part of IT band friction series. Last one, I love this. Shin splints. How do I tackle shin splints with any of these things? Is it possible? Such a good question. Shin splints is the epitome of silent culprit, noisy victim. That noisy victim is the shin. That bone, that tibia, it's getting force, impact, it's breaking down at a rate faster than it's able to recover. So yes, you're gonna have pain there. If you try to take a foam roller, a massage gun, a stick, and try to work that area out, don't do it. It's not gonna feel good. What we do is we go after the silent culprits, the hip mobility, the ankle mobility, the running form. We're trying to go after all these silent culprits that are not the main problem, but they're affecting and contributing to the shin splints. So hopefully that made sense. Silent culprit, noisy victim, vibration guns, move to not move. When do you use it? Before and after exercise. Hopefully these answer some questions. If not, please go and drop them down below. Light bulbs made sense. You've got some examples. Let me know.